When you spend most of the year battling the cold, Vermont's summer sun beckons like, well, a star. But skin cancer is real. So how do you enjoy the sun safely? In part 2 of our Summer Sun Worshipping series, we're learning from an expert. Today on Across the Fence. Hello, Vermont. Did you know that Vermont has the 3rd highest rate of melanoma per capita in the U.S.? A pilot study at the UVM Cancer Center is currently investigating whether that means there's something weird about Vermonters. Do we have unique DNA repair patterns? Unusual UV-induced mutations? Maybe. But an alternative working theory lies in our habits and demographics. We're an older state where 89.9% of the population identifies as white, and we spend a lot of time outdoors, even in the winter. If you watched part 1 of this 2-part Summer Sun Worshipping series yesterday, you know that there are lots of health benefits associated with sunlight. So by all means, stay outside. But how do you do it safely? And what do you need to know about skin cancer to make informed decisions? Those are great questions for my guest today. I'm joined by Dr. Santana VanDyke, a UVM Cancer Center dermatologist and assistant professor at UVM's Larner College of Medicine. Dr. VanDyke, welcome back to Across the Fence. I feel like this is apparently an annual meeting. Last year, I think I was probably in the hiring stages when you came and you met with Keith. I heard it was a great show. I've seen it. It is a great show. So anyway, nice to have you here again.
Absolutely. Happy to be back.
Yay. So I want to start by just talking about skin, because it's the largest organ in our body. What role does it play in our overall health and wellness? I don't know if we really, think about skin as being something that is a part of this larger body system.
Yeah. Well, as a dermatologist, I think about it all day long. And I do feel like it's the most important organ in our body, but I am a little bit biased. But it has so many benefits for our health. So not only does it protect us from the outdoor elements, it also is a way for us to see what might be happening internally. So the skin often manifests signs of disease before you develop other signs. So very, very important. But in addition, there's this strong relationship between skin and sunlight. So we know that sunlight is important for us, and it does so many wonderful things for us. So it helps with vitamin D synthesis, which many Vermonters are low on vitamin D. Right. There's also benefits of the sunlight decreasing your risk of high blood pressure, diabetes, and it also helps our mood. I know I certainly experience the seasonal affective disorder.
I know, the sun comes on
November
and we're all a little solar powered.
Exactly. But as you mentioned, there is a limit, and we want to make sure people are enjoying the sun safely.
Yeah. So is there a amount of time that we should have in our heads in terms of, and this probably also varies from person to person, but how much time is good to spend outside, maybe unprotected? I don't know if that's the right, and how good are most people at regulating or anticipating how much time they've really spent outside?
Absolutely. So one thing I hear very commonly is, well, we need the sun, I need vitamin D, and that's absolutely true. But studies have actually shown that 5 to 15 minutes of just sun exposure in the midday,
unprotected sun exposure,
unprotected, is enough for your vitamin D synthesis.
Okay.
And most of the time when people are applying sunscreen, they're not doing it by the book. So when they study sunscreen, everything's done very perfectly. We are not perfect. And so even if you're wearing sunscreen, you're missing spots. You're not reapplying as much as you should. That's just the average person. So you're still getting those benefits even if you're wearing protection.
Okay. I just mentioned how Vermont is a very white state. When it comes to skin cancer, why does that matter? I mean, so does everyone's skin respond to UV radiation the same way?
Absolutely not. So we all have a variety of skin tones, and that's due to the amount of melanin that our skin produces. So melanin is what provides pigment and does provide some protection. But even if you get, say, a tan, it's only providing about SPF 4 or 5, versus for sunscreen, we recommend SPF at least 30. And another thing is people aren't always realizing how much time they're spending in the sun. So people will put sunscreen on in the morning and then you know, by the end of the
all-day
day, you've done.
gardening session. And then you're like, I think it's probably been about, it's been about 5 hours and I haven't reapplied.
It goes by quickly. So, but yes, definitely differences. And I do think that's part of the reason we see such high rates of skin cancer is because of our population.
When you and I were talking about it, there's also the sun exposure that we just don't even register. Driving in the car, right? I mean, so I was sharing about how the right side of my face, because I'm usually a passenger, has more sun damage than the left side of my face, because the windshield is actually giving you some UV protection, but not those side windows of the car.
Exactly. And I know I love to roll my windows down on a nice summer day and hold my arm out. So we see a lot of skin cancers on the forearms, on the hands, and the sides of the face. And we think a lot of that's due to driving. So our truck drivers are at very high risk, people with long commutes. So definitely want to make sure you're wearing the sunscreen.
I did tell her that I had deliberately worn this shirt, so that not because I am looking for her to look over and say, hey, no problem, I'll just diagnose that spot for you, but more because, like, yes, indeed, this isn't forearms, that's a really big spot of accumulation, and I think a lot of that is just from driving around wearing short sleeves in California.
Absolutely.
So obviously I think I know the answer to this now. Is there any such thing as safe tanning?
No, unfortunately not. So I often hear, oh, I'm going to get my base tan this summer and then I'll be good to go. But as I mentioned, it's a very low SPF protection. So I think people think, oh, I have a tan, I'm protected from the sun, but it's very, very low protection. And once your skin tans, that's actually your skin already kind of screaming for help, because our skin tans as a response to UV damage. And so we make more melanin to try to protect our DNA. So when you look at our skin cells under the microscope, the melanin almost looks like little hats. So it's like our skin's trying to wear little hats to protect us. So there's no such thing as a safe suntan.
Okay, and that includes no safe tanning beds.
Exactly. Yeah, absolutely not.
Absolutely not. Okay, so now let's switch into the protection mode. What do you advise your patients about being outdoors in Vermont?
Yeah, so as I said, I love the sun. I think it's so important for our health, so we just want everyone doing it safely. So trying to avoid the hottest times of the day, which is usually 10 to 4.
Should you use the weather app and just look at that UV index?
Yeah, you absolutely can. I think that's so helpful. Let technology work for us.
This is a good reason to take your phone out.
Yes, exactly. And then, you know, I know some patients don't love wearing sunscreen. I do think it's one of our best forms of protection. So SPF 30 or higher should be broad spectrum, but there's also sun protective clothing. There's those really cute big hats that you can wear. They make a lot of the sun protective clothing where the fabric is woven in such a way that it protects against sun exposure. And I love those for my kayakers, canoers, fishermen, fisher people who are out, especially in the water a lot, because you're not having to reapply and think about that. And then seeking shade when you can, getting a nice umbrella, a nice beach tent, you know, all those things can be really helpful.
So it sounds like when we're talking about sunscreen, so broad spectrum, right? So we want UVA and UVB.
Yes.
And you said above 30?
At least 30.
At least 30, okay.
I usually tell my patients 50 or higher, because there is some data that SPF 50 provides a little bit longer protection. So you still have to be reapplying every couple of hours, more frequently if you're swimming or sweating heavily. But the SPF gives us a little bit of extra protection because we're not all perfect at reapplying like we should.
I have one more question. Well, no, I'm going to just jump right into the next one, because you just talked about longer lasting. So if folks travel and they've been to Europe or Asia, they would know that there's a lot more sunscreens out there than what we have here. And one of those, bemetrizanol, is now going to be released finally in the United States. What are some of the benefits of it? What should people know?
We have been behind for many years, so this is very, very exciting. This type of sunscreen lasts a little bit longer. You still are going to have to be reapplying every couple of hours, but maybe a little bit longer protection. It's also one chemical that protects against UVA and UVB, as you mentioned, broad spectrum. And it tends to be better for people with more sensitive skin. So a lot of the chemical sunscreens can be really harsh for people with more sensitive skin. So it's very exciting.
Yes, and for people who have had concerns or worries because of toxic exposures and chemicals, right? I mean, it's like it's a little bit less, it doesn't go into the bloodstream.
Exactly. So some of the chemical sunscreens have been shown to have trace amounts in the blood. We don't know exactly what that means. Is it harmful? Is it not? But with this, there's less concern with that. Okay,
so that's another good follow-up question. Mineral or chemical?
That's a tricky question. I think it depends on who you ask.
I'm a mineral girl.
Yeah. I think I am too. I think if you're looking for the safest option, mineral sunscreen. There's no evidence that it has systemic absorption versus, as I mentioned, with some of the chemical sunscreens, they have found trace amounts in the blood. We don't know that that's harmful. More studies need to be done, but if that's something you're worried about and a reason why you might not be wearing sunscreen, go for the mineral. And I like for the face the tinted mineral sunscreen, because a lot of people don't like
cast.
yeah, exactly. A lot of
we
people
all
don't like the white clown makeup is what I call it sometimes.
Yeah.
So.
How about lakes? I mean, like protecting the lake. So I'm from California, and there was a real push to get people to wear like a reef safe and yes, to help protect the water life and stuff, ecosystems. What about for the lake? What's a better formulation?
Absolutely. I would say mineral sunscreens, because trying to keep as many chemicals out of our lakes as we can is always a good thing.
Yeah. And how often should it be applied?
So every 2 hours in general. If you're swimming or sweating, really I say every half hour if you're really in the water and sweating. So that's where that sun protective clothing can come into play as well.
Right, exactly. So then you're not having to think about it so often.
Yeah,
Just wear
yeah.
a long shirt.
Yeah,
That's one of mine. And any tips for how to apply? How much?
Yeah, so that's a great question. So if you're applying on the face and neck, we usually say 3 finger lengths and widths. And then for your body, for an average person, usually about the size of a shot glass is enough for the whole body.
Which is probably about 2 to 3
2 to 3
times
as
much sunscreen as most of us are actually
Exactly.
putting on.
Especially if you're using the spray sunscreen, you're not getting.
I was just going to ask that. Are sprays as effective as creams or lotions?
They can be if you do them correctly, but most people are not doing them correctly. It always breaks my heart to see someone on the beach and you can just see their sunscreen blowing in the wind as they're spraying it on. So if you spray it directly into your hand or very, very close to your skin, you'll have a better result. But the creams and lotions really give you.
So for convenience. On the other hand, I've noticed that after about 2 sprays, those nozzles get clogged anyways, and then you are just shooting out the stream onto your skin. Okay, so final question. Who should see a dermatologist and when? When I kept talking to people about this segment, so many people said, I've never seen a dermatologist. Who should go and when should they go? Yeah,
so anyone who's had a history of skin cancer should definitely be seeing a dermatologist regularly. Anyone with a first-degree relative, so parent, sibling with a history of melanoma, patients with a history of tanning bed exposure or significant sun exposure are at higher risk. So I always encourage everyone to talk to your primary care doctor. They can do a general screening. If there's anything they're worried about or they feel that you're at higher risk, they'll refer you to see a dermatologist.
And then even, we only have like a second here, but ugly ducklings, right?
Yes.
Does that also keep your eyes peeled for
Absolutely.
ugly ducklings?
Ugly, it doesn't mean it's ugly, it's just standing out. So keep
anything
an eye
on
out.
your skin that just is like, that's unusual, it doesn't look like anything else
Exactly.
on my skin. Okay,
pimples
good.
that aren't healing, anything like that.
Okay, we're gonna have to do a follow-up show where we can talk about detection and treatment. Well, the UVM Cancer Center has lots more resources for you to check out related to skin cancer prevention, detection, and treatment. You can follow the link right there on your screen to learn more. Dr. Santana VanDyke, thank you so much for joining me today.
Thank you so much.
It was wonderful. And as always, thank you, Vermont, for learning and exploring with me today, and thanks to the team that makes Across the Fence possible. I'm Amy Finley. This is Across the Fence. Come back and let's learn and explore again tomorrow.